Beth, my name is Kathy and I'm going to be working with you today. I'm really glad you came in at the Crisis Center today. The other person that took your history told me some things that you've been through, and you've really been through a lot in your life, haven't you?
Yeah, I guess so.
Yeah. So it sounds to me like you're dealing with some depression and anxiety today. Okay, and that's been a problem in the past as well?
Yeah, long time really.
Okay, all right. Yeah, sounds like it's even gone back to childhood maybe.
I guess. I never thought about it, but I guess that is what was going on then.
Okay, all
yeah.
right. Well, in light of some of the things that you shared with the other practitioner, I wanted to share a guide with you that I found to be very helpful for people who have expressed similar things. Is that all right if I share this? Okay. So this is something called Dealing with the Effects of Trauma, a self-help guide.
Okay.
And I know trauma is a really big word. And what do you usually think of when you think of trauma?
Well, like people getting beaten or you know, like just really awful stuff.
Yeah. And so really though, it can be anything that makes you feel like your life has been threatened. Some of the things that you've gone through in the past, have you ever felt like that?
Yeah.
Yeah, I thought maybe you had. So that's why we use this word trauma. So don't let it scare you off.
Okay.
So I really like this because it's so short and it's just chock full of really good information and resources.
Okay.
It does talk about this being a really serious issue, that it is important to look at. If you've been through these things, or you've witnessed your loved ones, or even in your community, seeing people that you care about go through pretty difficult things, it can be traumatic for you and can possibly contribute to depression and anxiety and the symptoms.
Okay.
So it explains a little bit about that first. Then it talks about some specific symptoms. I know you talked about anxiety, insomnia, not being able to sleep, sometimes feeling anger that you don't know where it's coming from, feeling depressed, sometimes not being able to eat enough, or maybe eating too much at other times. I know you shared that. So I'll leave this for you to kind of look at the rest of them on your own. I just ask that you don't let yourself get overwhelmed. It's very normal for people to have these kinds of symptoms when they've gone through difficult things.
Okay.
So one of the other things I really like about this is that it gives some specifics about getting help from other providers, counselors, and groups, support groups, which we will be referring you to some support groups, and we'll give you some names of therapists here in the area. And I really like people to know what to expect when they go in. Have you ever been in therapy before?
Yeah, it didn't really help much.
Okay. One of the things that I find to be very helpful when people are able to do it is to take this with them and to say, this is how I'd like to work. I want to do some real specific work, because this goes into some skills that you can build to help with your symptoms and help deal with the trauma. So if you can help yourself be just a little bit assertive that way, it can be helpful.
Okay, I'll try.
All right. So this gives some general things that you can do. Just empowering yourself by coming in and asking for help today is a really big deal. Asking for support is becoming empowered. Getting some validation for what you've gone through and for your story is very important. So that's something that you look for when you're talking to someone. Are they able to hear your story and really, witness it with you and validate it for you?
And one of the therapists I saw, I could tell she was upset, and I didn't want to scare her.
Yeah, that happens. And so you do want to tell the person, I have some difficult things to share, and I don't want to share them with you if you can't hear them. It's okay for you to say that. Taking personal responsibility is really important, and that's what you've done today by coming in and asking for help, and that's what you'll continue to do when you reach out. So give some more of those, and then it goes into some real specific things that you can do, such as getting exercise, doing fun and creative things, using your spiritual resources, whatever those might be, if those are safe for you, putting some routine in your life, getting little things done, so that you can know that you have that ability. So one thing I ask people to do is, when you get up in the morning and you take a shower and you get dressed and you brush your teeth, give yourself credit for that. Sometimes people go,
It's hard some days.
Yeah. Sometimes people say, well, that's just what I should have done. And I say, yeah, well, when you're depressed, it's hard to do those things. So just pat yourself on the back and give yourself credit. So it gives you a lot of those. And then the last thing that it does, it talks about barriers to healing, some of the things that could get in the way. And then the last 2 pages are some other resources, things you can look up online. Okay? So I'm going to give this to you, and then I'm going to go get your referrals, and we'll get you in to see the doctor, and you'll be on your way, okay?
Thank you.
You're welcome.